I've been keeping you informed and up to date on the Ebola virus and the possibility that this deadly virus could reach the United States. Now, this video that you're about to watch is probably the most important video that I've ever put on YouTube. And after you watch this video, you will realize why you need to share this video with your friends and make it go viral. We need to put public pressure on those in charge here in the United States and make sure that we protect our people here, protect our lives, our family. Because what they're considering doing would jeopardize everyone's life here in the United States and actually all over the world, the spread of this Ebola virus. We already know that in Africa it's spreading like wildfire and they can't stop it. How did it start? It started with one person getting this virus and it spread to other people. And that's the same thing that it can do right here in the United States of America. If we allow them to bring patients from Africa that are infected with the Ebola virus back to our country, there is no 100% guarantee way to prevent this virus from one person, healthcare worker, or somebody else from getting this virus if they transport these patients over here by airplane and then spreading to somebody else, and then it takes off. Once it takes off, you can't stop it, and that's exactly what's happening in Africa. I want to show you this video first, and after this I want to show you the reasons why we should not allow anyone to be flown into this country that has this virus, whether they're dead or alive. And that's just the way it is. When healthcare workers go over there and doctors, they go over there with intentions to help people. That's what they do. And I thank them dearly for that. But you also have to understand the risk. When you go over there and they realize that they may contract this deadly Ebola virus, and if they do, they know the risk. They know that they may not be able to come back to the U.S. Whether they're alive or dead. They know this, but they accept that responsibility. And they have to accept that, and the families have to accept that. It's wonderful work that they do helping people, but we cannot jeopardize and risk the lives of everyone here in the United States and around the world because of a bad mistake. And if you bring these patients back over here, that's a bad mistake that could jeopardize a spread of this deadly virus all over the world. Let me show you this video first, and then I'm going to show you solid evidence why this should not occur.
Well, 2 Americans are sick with Ebola in Liberia as the death toll from the worst recorded outbreak in history passes 700 in West Africa, and it shows really no sign of slowing down. The 2 Americans are health workers who were trying to prevent the spread of the virus. If they survive, which is questionable over the next couple of days, they could soon be on their way back to the United States for treatment. So we wanted to talk more about this with Professor and Dr. Ian Lipkin, who has direct experience tracking down and identifying forms of the Ebola virus and other high-threat infections. A very interesting career, and it's great to have you on set, Doctor.
My pleasure.
So, do you think it's a good time to have these Americans come back to the United States knowing that they're infected with this virus?
Well, the risk really, now that when you know someone's infected and you can place them into isolation, the risk is really very small.
How small?
Very small. This is not like influenza or MERS or SARS, where you can communicate the infection easily by a cough or a sneeze or something of that nature. You have to have very close, prolonged, intimate contact with somebody's bodily secretions.
If that's the case, then how did it get so bad in West Africa? How did so many people become infected?
It's a very different culture there. First of all, they don't have the sorts of procedures we have for isolation of people. They are understaffed, which is a huge problem, a huge threat to us all. In addition, the culture there calls for families to take care of individuals when they're ill, to wash them and prepare them for burial. These are not things that we do in the developed world.
It's scary to hear about, and one sometimes thinks, well, if it happens there, then it could happen here. Is that true? Could the same sort of situation happen in the United States if we had some sort of outbreak like that?
So I think it's possible that someone could return from West Africa, in this case, or with other diseases from other parts of the world where, for example, you had SARS or MERS or what have you, but it wouldn't propagate, it wouldn't go further, because we would be able to recognize individuals who were infected, we could isolate them, and we could protect ourselves in that way. As I said earlier, the sorts of cultural practices which predispose to transmission taking close care of people, washing dead bodies, and so forth, just don't pertain in New York or in other parts of the United States.
I read that you actually worked closely with the Chinese government when the SARS outbreak actually happened back in the early 2000s.
I did indeed.
And you also are the one that discovered the West Nile virus as well.
Yes, but for example, just with reference to SARS, in 2003, when I returned, I was given a card at the airport that told me to report if I had any symptoms within 10 days of arrival in the U.S. I became ill at day 7, and I was placed into isolation.
And did you have SARS?
I did not have SARS. I had a very bad form of flu.
Well, it's interesting to hear that, and the reason why I bring up some of your past experiences, I'm just wondering how you go through your daily life, knowing that there's so many infectious diseases out there. Are you a guy that carries hand sanitizer wherever you go? Because I'm sure our viewers would like a little advice on how to stay healthy since you're so calm through hearing about the Ebola virus outbreak.
I do carry hand sanitizer, but the viruses about which I am most worried are the ones that infect my computer.
That's some good perspective for us, Doc.
Okay, there you go, see? Now, this is what I have to show you. Of course, they're downplaying this, but the fact is, it's very possible that if they fly these patients back here, who's most at risk? And everybody pretty much admits that health workers. That means doctors, nurses, the people that work in direct close contact with these patients. Now, we don't always know exactly how they get it. They use these protective gloves, this suit, all this stuff. It looks like something you'd wear on the moon. But the problem is, even though they've done this, just like one of the most recent ones, they still come down with it. So, what that tells us is we're not exactly sure how this virus gets into the bodies of some of these people. And because of that, it would be absolutely stupid to bring people that are infected with this deadly virus to the United States and take a chance on one of the doctors or healthcare workers here getting it. Because the problem also is you may not have signs right at first. So if you bring these people over here in an airplane and you put them in a hospital, wherever you're going to put them, an isolated place, wherever you're going to put them, and you treat them, these healthcare workers, the doctors, the nurses, these people, they're going to go home. They're not going to just stay there. And what the problem with that is, they may get exposure to the Ebola virus and not show any symptoms until it's too late and they're at home or they're walking out on a public street or at the grocery store, and then they're subjecting other people to the virus. And so there you go, okay? So all of a sudden they have symptoms, it's too late. They might have a little cut on their hand and touches an item on the grocery shelf, who knows what, and then somebody else has a cut and touches it, that's how it gets to somebody else. Things of that sort. It's even been found in droplets, air droplets, things of this sort. So there's many ways that you can get it, and the problem is all you need is one other person to get that, and then they go out into the public and they spread it to others. And that's how it spreads. That's how these viruses spread. The fact is, it can happen. It very well can happen. And why take that risk? Why risk the millions of people, the whole population here in the United States, and spreading it throughout the world, when you can keep these people isolated in Africa, and you can have whoever you want to bring over there, specialists? There's nothing more we can do here. This is a deadly virus. Bringing them here isn't going to save their life or cure them. It's just not going to happen. So why take that risk? Why would anyone want to take that risk? It makes no sense. What is the motive for doing so? Makes no sense. Shouldn't happen. I also uploaded a video the other day where I show you that Germany is now accepting patients with Ebola into their country from Africa. Makes no sense. See, family members that are infected, close contact, things of this sort, that's how you get it. So the problem is you bring these patients over here, and then you start bringing more and more. Two is not going to be enough, then it's going to be more. But if you bring any of them, regardless, all it takes is one patient infected with this deadly virus to transmit this to a healthcare worker, and then that healthcare worker transmits it to their family or people in the general public, and then people start traveling, and once they travel, there's no way to know who's been in contact with them, and it spreads all over the country. Then all of a sudden it pops up in this city, and then next thing you know, oh, it's in this city. How did it get there? Oh, they must have we don't know. That's how it happens. That's why these things happen. So it would be absolutely stupid to take this risk. And I'm telling you right now, do everything you can to contact your government representatives and let them know that you don't want anybody transported to this country that's infected with this deadly virus, Ebola. It's a big risk. It's putting everyone here in the country in danger. And you go out of your way to do that. You have to do that. That would be the biggest mistake in the history of the United States if we allowed this to happen. I want to show you this right here. This is from the CDC, Center for Disease Control. And let me show you what it says right here. Okay, right here. Ebola virus is transmitted by close contact with a person who has symptoms of Ebola infection. Once passengers have left an aircraft, the main source of infection will be been removed. However, infectious blood and/or body fluids that may remain on surfaces of the aircraft interior may pose a risk of infection if those particles come into direct contact with the person's eyes, nose, or mouth. So what are they telling you right here? What they're telling you right here is that somebody that has this Ebola virus, whatever they touch, regardless of what it is, it could have this virus on it. And if somebody else comes and touches that object, regardless of what it is, and then they touch their eyes, nose, or mouth, they can get the virus like this. Kind of like it's talked about with a cold, wash your hands real good. You touch an object and it has a cold virus on it, and then you put it up to your nose, your mouth, and you get it. Same way with this. That's what's going on here. They're telling you right here on the Center for Disease Control. Now, even if they did take these people that are going to treat the patients here and isolate them, it still does not guarantee that someone doesn't get outside of that facility. I don't know how they're going to do it. Or somebody doesn't get into that facility that's in contact. Or maybe the virus some way just gets on an object, and this object is taken out of the facility, and it's a mistake. We've seen mistakes recently by the CDC. We've seen big mistakes in the news recently. All you take is an object that's infected, that has this virus on it, it's taken outside the facility, or one of the healthcare workers gets it and then spreads it out in the community. This is a huge risk that does not and should not be taken. That's the bottom line. There's no ifs and buts about that. There's no reason to subject everybody here in the United States to this deadly virus by bringing them over here into this country. There's no purpose for it and no reason for it to happen. And like I said right here, it tells you, it's very clear on the Center for Disease Control, their website, guidance for airline cleaning personnel. And that's for airlines, of course, but that also, it could be for hospital situation. Because basically what they're telling you is that if an object is touched with bodily fluids, blood or bodily fluids, and somebody else touches that object and gets that blood or bodily fluid on their cut in their finger or on their hand or whatever, it can be transmitted that way. Or it can be transmitted from the finger into the eyes, nose, or mouth. And there you go. So it's very clear there. There's no mistake of how it can be transmitted and how dangerous this is. Okay, right here, MSD online. And this is the guidelines here. Okay, so susceptibility to disinfectants. Ebola virus is susceptible to sodium hypochlorite, lipid solvent, and it goes on to list a number of different things right there. And of course, these are things that you have to use. You have to use different things to eradicate this virus from surfaces and things. And there's not a whole lot of things that will do that. So there you go. Improper disinfecting could leave the virus alive. Once we get it over into the country, huge mistake it would be. Ebola crisis prompts the Center for Disease Control to warn against non-essential travel to West Africa. So this is new news today right here. Basically telling you, unless it's a dire emergency, don't go to West Africa, basically is what they're telling you. Because the virus is so prevalent there, it's just taking off like wildfire and killing hundreds of people. And that makes sense. This is good that they're doing this. But then, if you think about this, they're telling you not to go there, right? But then, there's a possibility that the United States government's going to allow 2 patients infected with the deadly virus to come back over here. Doesn't that kind of contradict? That makes no sense. Okay, right here. Now, I just want to go into quickly about how this virus started and how it kind of spread. We know that it's been linked to people, you know, that are involved with like gorillas, chimps, bats, things of that sort, fruit bats. In 2007, Uganda, an Ebola outbreak was traced to a couple of kids playing with fruit bats in a cave. And this type of stuff that's going on over, you know, in Africa that shouldn't be going on, that goes on, and that's where the problem comes in. They're also eating things over there that they shouldn't eat. Eating bats, eating monkeys, it's called bushmeat. And I saw a video the other day which has since been pulled, I guess. I don't know why, for what reason. But anyway, I saw a video the other day where it showed some of the Africans eating the bushmeat. And they were talking to them, and they weren't worried about it. They told them the risk, the high risk of possibly getting the deadly Ebola virus from eating the bushmeat. But they said that they're not worried about it. So they should continue to eat this meat. Which I think is illegal as far as I'm concerned, but they still do it. You know, there's no way to enforce it against all these people. And so some of the people are getting the deadly Ebola virus from eating monkeys, eating what they call bushmeat, and then some of them eating bats and things of this sort. And so that's a lack of education and understanding of these type things. So that's another problem right there. Through education, they need to enforce and stop these people from doing this. Because if you don't do that, how are you going to ever get rid of the Ebola virus if they keep eating meat that's infected with Ebola virus? It'll never stop. It's just going. And then once they do that, then they you know, they infect other people, and then it just keeps going on and on and on. So that makes no sense either. They're going to have to some way enforce it and stop these people from eating bats and bushmeat and all these strange things, because this is what's continuing to spread this virus, this deadly virus. Now, see, here's a picture of it right here. The monkeys, they put them up there and they cook them and eat them. And sometimes, you know, I don't know, probably, I mean, you can't guarantee just because you put fire over it, whatever, that's going to kill the Ebola virus. You have, because they eat all of it. I think they sometimes they'll eat the head and everything else. So, you know, there's the problem right there. You know, there's a picture of it right there. Now, another thing here, finally, Ebola virus could be into Britain through contaminated exotic bushmeat. That's another problem we have, and one more reason probably to stay off of airplanes, because they try to transport this stuff in luggage and things sometimes. This is crazy. We know that this bushmeat, I don't know why anybody in the United States would even want to eat it. I don't know if it's because they're originally from Africa or what, but I would want to stay the furthest away from something like that, because it could be contaminated with the Ebola virus. But we know that constantly bushmeat, which could be very likely possibly infected with Ebola virus, is trying to be smuggled into other countries. There's an example of Britain. It's also right here in the United States. I'll show you. Smuggled bushmeat brings viral threat to U.S. This is a video way back from 2012. They constantly have, we have special trained dogs at the airports that sniff out for certain things, fruits, vegetables, meats. And so when they get a hot spot, they hit it, then they look at it and see what it is, and obviously, you know, they have to destroy it. And I'm hoping that if they do find bushmeat, that they destroy it in the proper manner to where it can't continue to contain the deadly Ebola virus and possibly be picked up by somebody somewhere and exposed to it like that. I just don't know, but anyway, there it is. Now, all I can do is ask you to make this video go viral. I've explained to you why we cannot allow patients infected with the Ebola virus in Africa to come back to the United States, because it jeopardizes you, me, and our family and our loved ones, friends, everyone. We can't allow it to happen. So do whatever you can, spread this video. I've shown you the evidence, I've shown you the facts, and if it's too late, it's too late. Now's the time to do something about it. Thanks.